This is Module 5 of our online educational program. It is going to talk about the appearance of the carpal tunnel on ultrasound. Upon completion of this module, the student will be able to identify the borders and contents of the carpal tunnel on an ultrasound image. We'll be able to identify structures of the carpal tunnel on ultrasound during real-time and a still image. We'll be able to use anatomy knowledge to find the optimal orientation of the carpal tunnel using ultrasound. And we'll be able to describe strategies to confirm structures on an ultrasound when looking at the carpal tunnel. This is a quick overview of everything you learned in Module 1. Again, the borders of the carpal tunnel, the roof is the flexor retinaculum, the floor is the carpal sulcus, so depending on whether you're in the distal or proximal portion of the carpal tunnel, it depends what you're going to see. The ulnar wall is either the hook of the hamate and the pisiform, and the radial wall is the tubercle of the scaphoid and the tubercle of the trapezium. The contents of the carpal tunnel, you have one nerve and 9 tendons. The nerve is the median nerve, and it's located superficial in the carpal tunnel. And then you have 9 tendons, all acting on the digits. None of them are carpi muscles. None of the carpi muscles go through the carpal tunnel. So you're going to have the flexor pollicis longus situated superficially, 4 tendons of the flexor digitorum superficialis intermediately, and 4 tendons of the flexor digitorum profundus deep in the carpal tunnel. So always remember your anatomy. You have the flexor digitorum profundus. Those are right here, pretty deep. You have the flexor digitorum superficialis tendons, superficial to that. You're going to have the median nerve right here, very superficial in the carpal tunnel. And then you have the flexor pollicis longus. And then remember, no carpi muscles go through the carpal tunnel, but inside the flexor retinaculum, you have the flexor carpi radialis. Right there, there's the flexor retinaculum. Just superficial to that, you have the ulnar nerve and the ulnar artery and veins. And then, guess what? Very superficial, right in the center, you have the palmaris longus tendon. So sometimes you can see that on ultrasound, other times you can't. It depends where your focus is, on what depth, and of course if the person has it or not. Here's the carpal sulcus right here. We're going to go through a comparison. Here's my drawing that you've seen before of all of the contents of the carpal tunnel, as well as the bones that make up some of the borders. And here's what you're going to see on ultrasound. So it's a little bit harder to see all the structures, but I've labeled a few for you. The median nerve, very superficial right here, flexor retinaculum on the top. You have the ulnar nerve and artery right there. And then here you have the flexor digitorum superficialis and flexor digitorum profundus tendons with that ulnar bursa right there. Now I'm going to let you guys look at the carpal tunnel ultrasound image and try to see if you can find the structures that we've been talking about in our cartoon versions and what I just pointed out in the previous slide. So I'm going to give you a few seconds just to look at the image and try to find things, and then I'll point them out. Okay, so how you're going to orient yourself, you're going to find your bones. So here's the pisiform. The scaphoid's over here. The median nerve we have labeled right there for you guys. Here's the flexor digitorum superficialis tendons and the profundus tendons. The rest of the carpal sulcus is down here. Flexor retinaculum right here. Sometimes it's pretty hard to see, but sometimes here's the flexor pollicis longus. And then sometimes when you can see the scaphoid a little bit better, right next to the scaphoid, you can see the flexor carpi radialis. And just superficial on the ulnar side, you have the ulnar nerve and the ulnar artery. You can't see the veins here. And then in the center, you can sometimes see the palmaris longus right at the top. I really like this image because it shows you the location of the transducer when they take these ultrasound images. And then it gives you the image without labels and the image with labels. So let's go over this a little bit. First, you're going to find your bones, pisiform right here, scaphoid over here. Then the deepest layer, you're going to see the, right here, you're going to see the flexor digitorum profundus muscles, or the tendons. Just superficial to that, you're going to see the flexor digitorum superficialis or tendons. And then very superficial, you'll see the median nerve. So it's right up here and right there. That is all encased inside the flexor retinaculum, along with on the radial side, right there, you can see the flexor pollicis longus. Then outside of the flexor retinaculum, on the ulnar side, you're going to have the ulnar nerve and artery. And then on the radial side, right next to the scaphoid, you're going to have the flexor carpi radialis. Here's a video of the median nerve moving from the carpal tunnel to the pronator quadratus. So the transducer is placed on the carpal tunnel, and then it's moved proximally until the pronator quadratus can be seen. I want you to notice how the median nerve moves from superficial to deep as the video moves proximally, and also how the median nerve becomes more hyperechoic as it moves proximally. So again, here's the median nerve, and I'll follow along with you. So here, moving, moving, there it is, and there it is at the pronator quadratus. This is a ultrasound video of the transducer sitting on top of the carpal tunnel. It's going to sit there for a prolonged amount of time and then add a little bit of compression. So I want you to notice that with prolonged observation, the ulnar artery can be seen pulsating, and with compression of the transducer, the ulnar veins disappear. It's right there. You can really see it pulsating when it gets compressed, and then the veins come back. You can watch that video one more time. And it's compressed, they disappear, the artery is barely there, and then they come back. Some other pathologies to look out for when you're doing ultrasound at the carpal tunnel are flexor tendon tenosynovitis, which is inflammation of a tendon and its synovial sheath. Causes range from idiopathic, infectious, and inflammatory. In the top image, you can see a case of the flexor tendon tenosynovitis where there is very prominent edema around the flexor tendons. Remember that edema will be black because the fluid is anechoic. Then you have ganglion cysts, which are non-cancerous benign fluid-filled sacs, which commonly develop around the tendons or joints of the wrist and hand. They're thought to mainly reside on the dorsum of the wrist. However, one study found that the most common locations were 63% of patients had the ganglion cyst on the volar wrist located between the radial artery and the flexor carpi radialis, and 20% of patients had it on the dorsal location superficial to the scaphoidal ligament. And you can see the ganglion cyst in the image on the bottom. It's going to be right here. And it's between the radial artery and the flexor carpi radialis, which is indicated by the white arrow, is the cyst right there. And the cyst is anechoic because it is typically filled with fluid. The next pathology to look out for are any space-occupying lesions. This includes any foreign body or lesion which can take up space inside the carpal tunnel, causing median nerve compression and similar symptoms to carpal tunnel syndrome. Again, any of these things will take up space in the carpal tunnel, an area where it is very packed and you don't have a lot of space. So anything that can take up space will can cause compression of that median nerve and symptoms similar to carpal tunnel syndrome. You also have post-surgical complications, so the most frequent are neuromas of the palmar cutaneous branch of the median nerve, and other complications include neuromas of the dorsal sensory branch of the radial nerve. It's just a really cool image. It is post-carpal tunnel release. So these are ultrasound images of the patient with carpal tunnel syndrome before their carpal tunnel release, and then at 2 weeks, 3 months, 6 months, and 1 year post-op. The left images are all the median nerve in the longitudinal view, or the long axis, and then the right images are all the median nerve in a transverse view, or the short axis. And let me just show you. So just looking from this image, pre-carpal tunnel release, down to this image right here, which is a year post-op, you can see a giant compression or progression of the median nerve, just cross-sectional area. You can see it get smaller. So you can see the median nerve decreasing in size throughout the year post-carpal tunnel release. Here's some important information to remember. So get oriented by finding a bone, the pisiform or the scaphoid. Bones will have hyperechoic, bright cortical edges. Then keep in mind that the median nerve is superficial in the tunnel, and the nerve appears hypoechoic with hyperechoic speckles. You can also ask the patient to open and close their hand because the tendons are hyperechoic ovals dancing in the tunnel. You'll be able to see that when they move their fingers or they open and close their hand. You should also be able to see the ulnar artery pulsating. You saw that in a video earlier in this module. You looked for 3 black circles, 1 large, which is the artery, with 2 small ones, veins on either side. It almost looks like Mickey Mouse sometimes. And most importantly, remember your anatomy. If you get lost, think through it, reorient yourself by finding the bones, and just think through it. You know the structures, you know how they look, you know how they're located, and you know how to find them. Here are some references. And now it's time to check your understanding. So it's time to go to the module quizzes tab on the website and take the module 5 quiz. Good luck.